In terms of health provisions, we as the EFF believe that government should use this period to build permanent healthcare systems and infrastructure that will respond to all needs of our people. Instead of temporary hospitals, government should build an extended network of hospitals, clinics, polyclinics in all wards, townships, informal settlements, and villages. Government must make sure that some of the hotels, lodges, and other hospitality infrastructure must be converted into quality healthcare facilities, and some must be permanent for provision of primary healthcare to our people. The screening and testing of communities must not be done only during this, must form part of South Africa's health system going forward, including outreach campaigns to educate our people about preventative measures as it is the case now with coronavirus. Government should convert existing government infrastructure that is not being used for anything into accessible quality healthcare facilities. This should not be temporary because South Africa's health burden is one of the most devastating health burdens in the world. The population of South Africa is less than 1% of the global population, but more than 15% of HIV/AIDS related deaths come from South Africa. The defeat of corona must also mean that we deal with the heavy disease burden that defines our country. In the same way many countries built military reserves post-World War II, we should build healthcare reserves where ordinary citizens, professionals in other fields are trained, capacitated in the essential of primary health care. Soldiers, teachers, police, councillors, members of provincial legislatures, members of parliament must be provided with basic training to administer primary health care such as diseases, detection, screening, and administering of first aid care to all people. South Africa should build its pharmaceutical capacity to produce generic medicines and vaccines. We are aware that sometime the Cuban Center for Genetic Engineering has attempted to build relations with South Africa, and that was not given maximum attention. Now is the time to revive and strengthen the relationship with Cuba and build pharmaceutical capacity to produce our own medicine, not only for South Africa, but for the entire African continent. Our country currently imports more than 30 billion of pharmaceutical products from other parts of the world. It is high time we begin to produce our own medicines. South Africa should begin to locally manufacture and produce medical equipment, including ventilators. The South African government currently owns Denel, which produces high-tech fighting machines and aeroplanes. That capacity must be directed towards the production of medical equipment. How do we explain that we can build fighter jets in Denel, fighting flying machines, but we cannot build a ventilator which helps people to breathe? Why do we have capacity to produce machines, guns to fight wars, but cannot produce machines to save lives? The CSIR should be given maximum support and capacity to produce medical equipment, and the CSIR supported programs to produce test kits by black South Africans must be given maximum support. There is currently no sound reason why our country cannot produce its own masks, which are needed in the containment of coronavirus. We need to build local industrial capacity to produce our own medical equipment. The corona pandemic must be a clarion call that we need to build inward industrial capacity and not completely rely on the West and East for the provision of basic necessities.